Hello friends, hi, this is Dr. Shonali Chandra, your OBGYN faculty at PrepLadder, and I don't want to waste much of your time because I know that you people are gearing up for your upcoming INI-CET exam, and exam is merely approximately about 10 days later, right? So good evening Pavan, and good evening Deepak, and good evening everybody else who's joining in. And I can see some of you are here from yesterday's session as well. And good evening, Patel, Raj. Hello, everybody. Right. So which set of students are you? I mean, there are two sets of students. Somebody who's really gearing up for INI-CET and taking it really seriously. And then there's the other set who are, taking it up as let's say a stepping stone to NEET PG, and just taking it as a practice run. Well, it really doesn't matter. I mean, whichever block that you belong to, because at the end of the day, every exam that we give, and we are preparing for that exam, we should always give 100%, because you never know, you never know, right? So without wasting much of your time, because time is of the essence, let's have a look at some of the mistakes that students tend to do in INI-CET, particularly because you are so used to practicing for NEET PG and everything that, you do not enter into the examination hall thinking about the fact that INI-CET is a completely and entirely different pattern of examination altogether, because it will really test your, time management ability. And even with that, the first mistake that students tend to make is, not attempting enough questions, right? So it's a competitive exam. At the end of the day, you have negative marking also. So for each incorrect response, you get, minus 1/3. And for each correct answer, you get a +1 mark, right? So how many questions would be a safe bet to attempt? Now, if you listen to the toppers interview and everything, and most of the toppers are attempting, at least 190 plus questions, right? And from what we have seen over the years with the way the ranks come and the students give their feedback that how many questions they are attempted, if you're attempting less than 170, you're out of the game, right? So I would say enough questions would be somewhere around 180 minimum. Good bet would be to 180 to reach 185, right? And the other thing is that when you have to attempt so many questions, I mean, out of 200 questions, if you want to attempt 180 questions, the thing is that there will be only approximately about 60% of questions where you will really be sure of your answer. Right. So the next question is which one should you be really attempting, because 100% sure you will be in 60% of the questions only. So attempt those where you are able to rule out options. INI-CET exam is really about eliminating options, I'll tell you. So even if you're able to eliminate one option, and that will also happen in areas that you have read up and you have studied, right? थोड़ा बहुत idea होगा उस question के बारे में. If you're able to rule out even one option, you rule out two options, very good, right? But even if you're able to rule out one option, give attempt, because ऐसा नहीं होगा, you will not be able, you have to attempt even if you're not 100% sure about the option, right? And move on. Yes, move on from the question if you have absolutely no idea about the question. I mean, INI-CET sometimes obviously will throw these oddballs as well, right? One-off questions and controversial questions and, those difficult questions. Aisa hoga. So move on if you can't, rule out any one option as well. So I would not say that you need to take a risk. I would say that what you need to do is take a leap of faith while attempting these questions. So that's important, right? And if you're having any doubts, please keep putting them on the chat box and I will go through them as well simultaneously. The other thing that you need to keep in mind while doing the exam is you need to keep up the pace. That is the most important thing. You have to maintain that pace right from the beginning of the exam to the end of the exam, because see, your paper will be set in 4 sets, okay? 50 questions in each set, and you'll get 45 minutes for each set. That is, less than 1 minute per question. And the other interesting thing with INI-CET is that you will be able to solve in sets only. So once your set is done, it will get automatically submitted, meaning that once your 45 minutes are over, it will get submitted automatically. The next set will start coming in front of you, right? And you will not be able to return to the set again. Okay, so if you have, let's say, left questions unanswered and you want to come back to them later, or maybe you have attempted a question and still want to come back to that later, you have to keep those questions to bare minimum. Okay, so don't leave too many questions for review. Your time for review will not come if you are leaving too many questions there. So best to attempt the question in the first thorough read itself, in the first attempt that you're giving the paper, right? And if you ask me how many questions should you be leaving for review, as few as possible. I think I can put a maximum cap to it, maximum 5 for review, max to max 5 for a review, right? And please remember, if you have marked a question, attempted, right, attempted a question, chosen an answer, and then you have clicked save and mark for review, okay, if you're not able to come back to that question and change that answer, it will be accepted whichever way it is. Okay, it will be, if you've answered it, attempted it, chosen an option, that option will be considered as your answer. So that is why when you are answering the first time, be very sure that you are answering what you want to, and don't leave too much, okay, I will change it later when I come back, or I have the potential of changing it later when I will come back to the question. So keeping the pace is important throughout your exam. And the other thing with INI-CET is that 60 to 70% of your question paper you'll realize is more clinically oriented, clinical scenario based questions, long read questions, right? And with less than a minute to solve such questions, one really tends to get hassled by those long questions, right? The moment you let anxiety settle in, and that is when you start misreading or reading the question too fast. So practice reading it very slowly, right? Read carefully and strategically, right? So one strategy that we all tell our students is that when you have a long question to read, it is a very good idea that you read the last line of the question first. I'll give you an example. You read through the whole story of the question without knowing what they are trying to ask you in the question. That you realize in the last part of the question, right? So for example, many times they're not asking you the question about diagnosis. Maybe they're asking you the question about the next step or the next investigation, and the diagnosis is hidden somewhere in the question. All right, or the diagnosis may be actually fairly evidently given in the question itself, right? So that is wastage of time. So you read the last line. Many times, when you read the last line and you look at the options, looking at the options also, you understand, you realize what they are trying to ask you in that question. Okay, so keep that in mind, and do not miss out on especially you miss out on all except. Many times when we are having test and discussions also, and students are answering online, you tend to miss out and misread all except, right? All among are true except which among them is false, or which among them is true, right? So you have to read that last line very, very carefully, and trust me, the first line of the question is also extremely important. Why? I'll tell you, because the most crucial sometimes information is hidden in the first line of the question. I'll give you, for example, so many gynae questions and ops questions come where your answer or your modality of treatment will change based on the age of the woman, the parity of the woman, or any other significant high risk factor hidden in the history, like a previous cesarean section, for example, right? So that most of the times is in the first line of the question. A patient aged this, right, gravida para this, and with this particular history, which is very, very important. And when you are reaching the end of the question, you have by that time forgotten what was there in the first line. So that's why the first line, the last line, very, very crucial and important. So avoid misreading and misinterpreting also, right? Why do I say avoid misinterpreting? Right, so I'm just having a look at your live chats also meanwhile, right? Because I can see some of the questions which I'm not able to see on my tab. Yeah. All right, so I'm getting a look at your questions. I will keep taking your questions at the end of the lecture, right? So we're talking about misinterpreting the question. See, please keep in mind you have to stick to PYQs, okay? Now PYQs or previous year questions often are repeated. Previous year topics, previous year questions are very often repeated in INI-CET, but please remember they may not exactly be the same. Right now, AIMS and INI-CET, they have this habit of asking very basic questions in a sort of a twisted manner. They will tweak it. They asked something the last time, they will tweak it a little bit, right? Or the last time they asked about diagnosis, and this time in the same scenario they may be asking about the next best investigation or the next initial investigation or the investigation of choice. So these little words in the question, right, they matter. So avoid misinterpreting. If you do happen to come across a PYQ, just read it very carefully. It may not be exact, repeat most of the times, right? Now, so eliminating options is the best strategy, and stick to reasoning and logic. That will get you through most of your questions. That will get you most of your questions, right? Now, all right. Moving on, avoid overthinking while you are attempting the exam. Now, what do we mean by overthinking? And all of us have done it. All of us do it, right? So what I'm trying to tell you is that once you have made up your mind about a particular answer, about a particular option, don't change it, right? Do not overthink on options once you have made up your mind. And please do not go for rare possibilities. It is extremely unlikely that a rare situation or a rare possibility would be an answer. Please keep that in mind, and leave the questions that seem controversial. As simple as that. You have to keep up the pace. You can't get hung up on one question, So out of the park questions are always going to be there. Out of the blue situations will always be there. At least 20 questions will be there, which majority of you people or the majority of the people attempting will not be able to solve. Let go of those questions, right? Those are not there to decide your rank, or they are not there. Those questions are not kept there to decide your selection any which ways, right? And the other thing, don't let your nerves overpower you. And it happens to the best of us, so breathe and relax, right? So like many times, because what you're getting, the questions are in your sets. It happens sometimes, it's very randomly selected. You may start with a bad set, okay? You may start with a set that is not appealing to you. It is not working out for you. Don't get hung up on it. Just breathe and relax. There will be other sets that are coming up, right? Don't get hung up on a particular question. Many times that question that we are not able to attempt or answer, or it just keeps troubling us in the back of our minds. Let go, right? That is all that I can say to you regarding this. I mean, don't let your nerves overpower you, because all of you have studied, all of you have done a hard work, right? And the only difference that is there between somebody who cracks it and who doesn't during the exam is actually how you maintain your calm, during those 3 hours of the test. Okay. Now, what to do right now? So I have told you how to spend those 3 hours in INI-CET examination hall. What you need to do right now with 10 days to go, I think first of all, don't pressurize yourself in the sense that you've given GTs, you're getting your scores, you're getting your ranks. I mean, really don't look at them. It doesn't really matter now in the last moment, right? Even if you don't give GTs for these last 10 days, it's going to be fine. So don't pressurize yourself over that. Stick to previous year topics and previous year questions. Majority, 80% of your paper is going to be from there, right? And make sure that all your high yielding subjects and previous year topics from the high yielding subjects, right, you brush through them. You have to go past them. इस समय अगर active recall नहीं हो पा रहा, right, because time is the crunch, right? If you're not able to actively recall, fine, don't pressurize yourself. Make sure you go through your material once at least. Let it pass in front of your eyes. That is what is most important, right? Previous questions karte raho, because you want to also get into the hang of guessing. Okay, now when I say guessing, please understand, we are talking about calculated guesswork. We're not talking about random guesswork. Okay, avoid new material. It's very important. It's something that many of you disregard this advice. You know, you add new material. Abhi jo bana liya aapka material, wherever you're reading it from, right? Stick to that source. That is going to be very, very important. And don't waste time trying to figure out answers to controversial questions. You know, all of these questions which you find in discussion forums or sometimes in Q banks, they are recall questions. Okay, and recall questions always have that slight bit of we try to correct for the recall as much as possible, try to simplify it, because and recall questions also comes to us from students only. So in the examination hall, sometimes students think, I have attempted correctly, मुझे ये लगा था, मुझे ये सही लगा था, या ये ऑप्शन था, या क्वेश्चन की स्टेम ऐसी थी, या ये था वो था. अब इस ये था वो था में ना आंसर बदल जाता है, right? Because at the end of the day, what the examiner is asking you, what the examiner wants the answer as, only that examiner knows, right? So what you do in the examination hall, only you know, frankly speaking, right? So do not waste time on controversial questions trying to figure it out, and waste time on those questions right now, right? And the last thing that you need to do right now is get your sleep pattern right. I was, at least in my days, a nighttime reader, and I had a very hard time getting up in the morning and being most productive at about 10 or 11 or 12 in the noon. That was my least productive time, and I would get more productive in the evening hours. Now that is something, a very bad strategy to have. So those of you who are night crawlers, please keep in mind that you need to set your sleep pattern right. You need to be focused, up your game, and focused in the early hours of the morning and afternoon. So keep that in mind, right? So get your sleep pattern right. So that is from me, guys, the update on the mistakes to avoid for INI-CET. I wish you all the best for your upcoming exam, and let's have a look at some of the questions that you are asking, right? And if there's any doubts, right? Now, somebody's asking me how to revise OBG. It's now sufficient to go with or. See, OBG, if you have been following my lectures for OBG, what I want to tell you is, especially if you're asking for about INI-CET, the LRR that we did yesterday, that was very condensed. Okay, you want to read a little bit more, there were 2 LRRs that was conducted for the previous exam. They're still on YouTube and they are live on YouTube. You go through that. Gynae is done separately, OBS is done separately. That covers about 80% of your syllabus, right? Now, can we improve plus 15 questions from average GT scores in these 14 days? Your GT scores, frankly speaking, are not going to be a reflection of what your final scores is, right? So do not think that can you do it or can you not do it, okay? I'm telling you, just get rid of this idea about GT scores reflecting what your worth is. Forget about GT scores right now. Okay, not 10 days before the exam. The scope of improving the GT scores is in the 3 months prior to the exam, not 10 days prior to the exam. Please keep that in mind as well. Otherwise, most of the times you're going to be fairly around your GT score marks. But even in the last 14 days, yes, there is scope of improvement, provided you go through and brush through the previous year topics thoroughly. Okay, that should help you up your marks, right? Okay. All right. Now, people are asking me how many correct required for under 1000 rank. See, it's not about how many correct required. It is mostly about the number of attempt questions that are attempted, because it is at the end of the day, the ranking will be a percentile system. There is also again going to be a system if you get stuck on the same, if you're getting the same sort of percentile marks, then wo tiebreaker wala issue bhi hota hai. So do not focus on how many you have to get right. Okay, you will not know how many you are getting right while you're doing the exam. You have to focus on how many you are attempting. Okay, so if you're attempting 180, 185 questions out of 200, like I said in the beginning of my presentation, and you are making because you will have to make calculated guesses in a lot of your questions, 100% sure you will not be off your answer, especially when it is INI-CET, right? So attempting is the key. If you're attempting less, you're out of the game as it is, right? So for a plus 1000 rank, you should, within 1000 rank, you should be attempting at least 180, 185 questions. All right. All right, Isha, you're asking how many years should be skimmed through last year paper, right? Last 5-year papers. Last 5-year papers, my dear, bare minimum. Okay, bare minimum in the last 10 days. I would say last 5 years. If you would have, if you would have asked me this question, let's say a month ago, I would have said last 10-year papers. But with 10 days to go, I would say last 5 years paper you should skim through. Okay. Any more questions? I'm having a look at your chats also. All right. Thank you, Isha. Thank you, Isha, for your kind words. And there is somebody who's telling me कि क्या abroad का बच्चा clear कर सकता है क्या? बिल्कुल कर सकता है. I mean, why not? Right? It's ऐसा नहीं है आपको. You have to put in the right effort. You have to strategize correctly. And it doesn't matter. See, nobody's starting point in any race. That is how life is going to give it to you. Okay? Nobody's starting point in a race, especially in these competitive exams, is the same. Okay, starting point किसी का same नहीं है, right? So maybe for you, depending on where you are starting from, the effort may be more, but it is obviously doable, right? So just face that reality and push through it. Okay. Chalo then. So no more further questions. I think no wasting more of your precious time, guys. All the best. Gear up for your exams. And I hope to see you all come out with flying colors, right? So work hard. Bye-bye.